So, Ellie, you've chosen music therapy as your element or role that you've researched. I mentioned earlier that I think it's perhaps an area that we probably all know least about in comparison to some of the other things that have been covered. So, yeah, let's hear what you've got to say.
Okay, so the hours that you work is the usual, like 8 hours Monday to Friday, but sometimes they involve evening or weekend sessions, like depending on who you're working with. The salary, so usually if you're working for the NHS, and the starting salaries are from like 26 grand to 35 grand a year. But if you're more experienced, you get a bit more. And if you're really, really experienced, you get probably about 50 grand a year. But if you aren't employed by a company and you're freelance, then your salary will just vary depending on what you're doing. The responsibilities, so kind of, it's for like a broad range of people if you work with them. So you could be working with anybody who has any type of problem or difficulty, and you kind of have to take an active role in music that you're making with them. You have to plan and record sessions and be organised. You have to be encouraging and understanding and patient, and you need to attend meetings with other professionals. The qualifications required is that you need to be properly trained at postgraduate levels. That means you need to get a master's in music therapy. So you have to do a degree before that and then go on to do a master's. And it needs to be approved by the HCPC. And after that as well, you can join the British Association for Music Therapy as a practitioner. Experience and practical skills. You probably need to do work experience. It doesn't really matter that much if it's music, but you probably need to do it like in caring role and working with vulnerable people. You need to be a good musician in general, just know your basic stuff, so that you can like help them make music. You need to be able to improvise and use music expressively. You need to have listening and observational skills so you can understand your client's needs. Imagination, creativity, communication skills. You need to be mature and be able to deal with challenging situations. You need to be able to empathise, have patience and respect for the confidentiality of what you're working with. So the location is usually places like schools, hospitals, care homes, day centres, community settings, workplaces, and even like prisons if you're going to work with criminals and stuff. It means you need to be adaptable to multiple environments, and you should probably bring a calm atmosphere to everything. There's a few locations in the UK that do music therapy master courses, and they've been approved by the HPCP or whatever it is. There's one in Derby, or Derby, I can't say it. There's one in London, South Wales, Edinburgh, and Bristol, UE, which is a music therapy module in their music course and their master's degree. And employers in the future would be the NHS, or you could go freelance, or the British Music Association thing. So the specifications, basically you're using music as a form of therapy in order to help people that need it. So if you're working with someone who has anxiety, for example, you'd encourage them to write a song or use instruments to express themselves so that they can communicate how they feel, and then as well as that you can kind of figure out stuff that people might not know what's wrong with them. So then if you do it through music and it makes it easier for them to communicate, then you can find out if they might need medication or what might be going on in their lives. It's just like a way of expression. And I've chosen it because I believe that my nature suits the job, and I think it would be enjoyable and challenging at the same time, because your work is very difficult. You're going to be working in tough situations, but you're making something good out of it. And I think it's a bonus because the courses and employers, and the Association of Music Therapy is kind of situated in the city that I want to move to and go to university in. So that's it.
Cool, great stuff. Well done, Ed. So with that, what I'm kind of getting from it, I'm sure the rest of you are, that yes, the performance stuff is still there, but there's a much greater responsibility to your clients. You're going to be working on your own, and the qualification is something you're going to have to dedicate that time to for that 3-year duration before you're let loose in that environment. And clearly, the qualification has got to fit with that responsibility. So again, ticking more boxes, but great research on that as well, and yeah, some really good content there. And I think after that, because it's probably the role we're least familiar with, it might be something that you guys might look at and think, well, actually, it could be a good viable kind of role to look at. Well done, great.